Okay, ma'am, I'm ready.
Right, so if you've read and understood, considering its surgical anatomy station, please tell me first of all, what is the provisional condition that you've diagnosed here?
Goiter, ma'am.
Is it goiter? Okay, right. Please tell me, what are you looking at? My very favorite image.
Yes, ma'am. I'm looking at anterior and posterior triangles of the neck from the side.
Very good. Okay, please tell me, how would you classify or further divide anterior triangles of the neck?
Anterior triangles are divided by the digastric and omohyoid
Uh,
into three.
Please identify which number is this. Point it. Which one is which? Which is
Uh,
this? Number 12 and which is number 1?
okay, number one is anterior belly of digastric.
Okay. What is 12?
12. Yes,
What is,
12.
yes, here. Have a look.
Okay, so this is anterior belly of digastric, yes.
All right. What is 9?
This is the inferior belly of, superior belly of omohyoid.
So as a whole, there are how many small triangles anteriorly in the anterior neck?
In the anterior neck, there are three subtriangles.
4.
Sub Four: submental, submandibular, carotid, and muscular.
Very good. So there are 4. Can you identify this number 4?
Yes, this is sternocleidomastoid.
Please tell me the attachment and function of this muscle.
It has two heads. One attaches to the clavicle and one to the sternal head. And its function is
These
to
are
rotate.
insertions you're telling me. It
Yes,
starts from here. What
yes.
is this
Origin
area
is
for?
from the occiput. Occiput.
Okay, what's the action of this
It
muscle?
turns the neck to the contralateral side.
Okay, this makes the landmark for the posterior triangle. Please tell
Yes.
me how many posterior triangles there are and what are their contents.
There's one posterior triangle, and the contents are divided into nerves, vessels, muscles, and yes, and lymph nodes.
There are two posterior triangles. What is this structure dividing the posterior triangles into 2? This is number 7 is also 1. And this is number 3 is 1. So what is
Ma'am,
this structure?
this is in inferior belly of omohyoid, but in
Yes.
my notes, it is included in posterior compartment contents.
There are two posterior compartments,
Okay.
posterior necks, yeah, divided into 2. Anyway, right. Okay, you told me about the carotid triangle. Please tell me the contents of the carotid triangle.
Contents of carotid triangle are common carotid artery, internal jugular vein, and ansa cervicalis,
And what is
and vagus nerve.
okay, good. You were missing something. Right. Please tell me what are you looking at?
I'm looking at the neck,
Okay. Cadaver,
anterior.
yes, dissected view or the front of the neck in the cadaver. Please identify number C.
Number C is internal jugular.
I'm asking, I'm not telling.
Yes,
Okay. What is A?
A is lateral lobe of thyroid.
Please tell me, yes, the structure of the thyroid, how many lobes there are, and the surface anatomy of the thyroid gland, please.
Yes, it extends from thyroid cartilage to the
Which? Okay.
at the C4 vertebral level.
Yes.
It is below the thyroid cartilage
Yes.
and extends up to cervical rings. I think C2 or C3.
Okay. And It has two lobes and
There are two lateral
these are,
lobes and
you are
one.
supposed to be telling me all this.
Yes,
What
there are
is
there are two lateral lobes and one isthmus.
isthmus? Okay. Please tell me the blood supply of the thyroid gland.
Superior thyroid artery branch of external carotid supplies the superior lobe, and inferior thyroid artery supplies the inferior lobe, which is branch of the subclavian artery. And there is also another artery, that is thyroid artery, which supplies the
Which is
10%
branch of which vessel?
of brachiocephalic or aorta.
Okay, when blood supply is asked, then it means both blood and the venous drainage. So please
Okay.
tell me the venous drainage as well quickly.
The superior and middle thyroid veins drain into the internal jugular vein, and they drain the superior part of the thyroid, and the inferior thyroid vein drain to the brachiocephalic vein.
Okay, good. Please tell me what are the posterior relations of thyroid gland?
Thyroid gland posteriorly has a trachea and then esophagus.
Are you sure? Are they separated by something? Or they are,
Yes.
is it in direct contact with esophagus and trachea and everything?
No, they are separated by the pretracheal fascia.
Okay. Yes. And what more?
And
Very important.
lateral to it is the carotid sheet, which encloses the common carotid, internal jugular vein, and vagus.
And another very important structures.
And the
Structures.
posterior inferiorly, there are four parathyroid glands, two superior,
Yes.
two inferior.
All right, good. Okay, moving on. Please, if you could identify structure 11 here.
This is
And
external. This is
yes,
external jugular vein.
very good. Please tell me the tributaries of this structure.
External jugular vein has a retromandibular vein and facial vein at the
Yes, they
uh,
unite to
to
form.
form the external
Where
jugular vein.
exactly? Tell me the surface marking, please. Where exactly?
Uh, this sorry,
Okay,
at the
where?
anterior border,
Yes, please.
at the anterior border of sternocleidomastoid,
Yes.
one third from up to down.
Okay. Please tell me where this external jugular vein opens or drains here. What is
External
it?
jugular vein opens to the subclavian vein.
Okay. Moving on to the image on the right hand side. If you could identify structure 11, please.
Yes, this is the external carotid
Artery.
artery. Yes.
Yes. Please tell me the branches of external carotid artery.
External carotid artery has six branches in the neck, three anterior, two posterior, and one deep. Three anterior are the and superior thyroid, and two posterior are posterior auricular and occipital, and the deep one is ascending pharyngeal. And there are two terminal branches in the parotid, which are superficial temporal and maxillary.
Okay, and this itself, external carotid artery, is branch of which vessel?
Common carotid.
Yes. All right. Okay. If you could identify, is there anything else you could identify here?
Well, I can identify everything here.
Okay, very good. If you could identify, I want you to identify something very common. Okay, maybe these 54 and 45, if you could identify these.
Yes, this is sternohyoid and
Which one? 54 is superior belly
no,
of omohyoid.
54 is superior belly of omohyoid. This is 45 is sternohyoid.
Yes, very good. And 46, where exactly is that? Yes, here. What are these? What type of muscles are these?
Strap muscles.
Yes. How many are they in number?
They are 7 or 8.
What is their purpose? Or what is their function?
Do they help in the voice, because when the
All
hyoid
of
bone,
them,
not all of them,
except
these are
which one?
laryngeal muscles that help in voice production.
Okay, would you be able to identify what is 56?
56.
Yes, here. See?
Yeah, 56. This is superior thyroid artery.
Very good. Excellent. Now you know it. 61.
61. This is trapezius.
Yes. Marks the posterior border of the posterior triangle.
Yes.
Very good. Okay. Yes. Thank you.
Thank you, ma'am.